Thank you so much, Sanjeev. So firstly, like Sanjeev was saying, the focus of today's talk is actually to get a better understanding about diabetes. So to understand what are the factors that can cause onset of diabetes, especially early onset of diabetes, how do you recognize it early on? Do you really have to wait till the point that you're diabetic before you even pick up the journey towards development of diabetes? And then lastly, of course, focusing on what are those changes in lifestyle factors that you can do that maybe can reverse and prevent the onset of diabetes. But before I actually go into all of that, I just thought like, let's keep it a little bit more interactive. So there's some questions that I'm going to ask. So please feel free to either unmute yourself and answer, or you can just drop the answer in the chat box and then we'll have a discussion on that. So firstly, let's start with the first question. So what's the first word that pops into your mind when I say diabetes? What's the first thing that comes to your mind when I say diabetes? So you can unmute yourself, give your answer, or you can just drop it in the chat box. Sugar, 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 high sugar. Okay. Anything else?
More insulin in the body or no secretion of insulin.
Yes, yes, perfect. Carbs. Awesome. So everyone has an understanding that diabetes, of course, is a state of elevated blood sugar levels. One cause that can cause this elevation in blood sugars is a very carbohydrate-rich diet. And yes, there's a state of insulin resistance in your body, which is in type 2 diabetes, but in type 1, there's an insulin production problem. So yes, all your answers were correct. And this kind of sums up a bit about diabetes. So let's go on to another question. Do you think eating sugar causes diabetes?
Yes, it does.
Okay. No, not really. Some people are saying more than required level, no lifestyle, right? So Aparna, Aditya, Nishita, Veena, all of you guys are right. So your lifestyle choices are what causes the onset of diabetes. Like for example, a carbohydrate-rich diet, not exercising enough, not sleeping enough, having elevated stress levels. Though I will go into detail about all of this a little later. This is just for us to kind of get into understanding a bit about diabetes. See, sugar, colloquially, sugar actually means white sugar or brown sugar, your processed sugar. Now, the diabetes in your body, a lot of people colloquially kind of call it sugar, ya sugar ki bimari, right? But sugar will not per se cause diabetes. It is when you have increased carbohydrate intake is when you will develop diabetes. But if you say have a rich meal and at the end of the meal, you have a habit of eating 2, 3, 4 sweets, you're in a habit of consuming, say, a lot of this refined maida, cakes, pastry on a daily basis, then of course it will add on to the early onset or worsening of diabetes. But that is not standalone of factor. So that's right. Is diabetes reversal a fact or a myth?
Definitely a fact.
Mm-hmm.
That's why we are here.
Yes, it is definitely a fact. It's something that people have done, people have achieved, it's being proven all over the world. And that's the whole understanding. That's what we are here for, like you said, sir. So we are here to understand how you can reverse the state of diabetes. Okay, another question, okay? So I'll give you 3 options and you choose the right one. So which one of these 3 do you think is the reason why you develop diabetes? Your genes, option A, B, your lifestyle, or C, a combination of genes and lifestyle?
C.
C. Yes, all of you absolutely are right. So let's look at it this way. So you might have a strong family history of diabetes. Yes, there might be people who are diabetic in your family, your parents, your grandparents. So you've inherited the gene. The gene is a seed. That's it. For that seed to germinate and manifest itself, it's the environment that you are providing for it to manifest itself, and that's your lifestyle. So it's a combination of both. Lifestyle, of course, I would actually put down to almost 80% of the cause. Genes is something that's just predisposing you to it. Okay, last question. How many of you believe that doing household related activities is equivalent to exercise?
No. No.
I can see Sanjeev going, no. But surprise, surprise, actually household activities are a form of aerobic exercise. So it does help in a lot of calorie burn. And in fact, we do encourage people to do some form of household activity. It could be just vacuuming, it could be dusting, it could be anything. So COVID in a way did exercise our body for all the staying at home that we did. Okay, so with that context kind of set, let me kind of go on to actually talking about, these points. Screen sharing has been disabled. Sorry, Cynthia. Okay. Right. Okay, I think that's visible to everyone. So first, let's understand what are the types of diabetes that we have out there. Okay, so the most common type of diabetes that we have globally is type 2 diabetes. Okay, and type 2 diabetes is the one in which a combination of your genes and lifestyle choices causes its manifestation, and in fact it can manifest itself at a very young age. Now, a precursor to type 2 diabetes is a condition which is known as pre-diabetes, which you can consider it to be like a warning signal from your body saying that your sugars are elevated, not so high as for you to get diagnosed as diabetic. So it's a warning and you can work towards reversing it. There are other types too, like type 1 diabetes. So in type 1 diabetes, you usually develop it in your childhood. There's an insulin production problem. So you have to get onto insulin very, very early in life. There can also be diabetes in pregnancy, which is when there are certain hormones which are released into your bloodstream during your pregnancy, which can change the way in which your cells react to glucose in your body. And that is when you might get diagnosed with something known as gestational diabetes. Drug-induced diabetes is another form wherein if you are on long-term steroids, it can cause the onset of diabetes. And some surgery-induced, autoimmune-induced, but our whole focus today is pre-diabetes and type 2 diabetes. Now, I'll tell you why. On a global scale, when we look at just pre-diabetes, let's forget type 2 diabetes, just pre-diabetes, and that was just in Southeast Asia itself, as of 2017, they found that about maybe 29.1 million people were already pre-diabetic, and the number was projected to increase to 2045 to about 50 million people. What's the problem with these numbers? These are the people who are going to go on to become diabetic in the days to come. So we are worried, we are concerned about this. If we take type 2 diabetes, as of 2015, again, it was just 415 million people who were diagnosed to be type 2 diabetic, and the number is projected to hit 642 million people by 2040. In Southeast Asia itself, the number is projected to hit 140 million people. Now, when we take India, as of 2019, there were 77 million people living with type 2 diabetes, and the number is projected to hit 134 million people by 2045. Now, what's the problem with diabetes? Okay, so these are all the statistics, but what's the problem? After all, it causes elevated blood sugar levels. So why are we so worried? When your blood sugar levels are elevated, it causes a state of inflammation. This inflammation can damage various nerves and blood vessels in your body, and this will go on to affect various vital organs in your body. It causes increased frequency of strokes, increased frequency of heart attacks, and especially the heart attacks in diabetes is known as a silent attack, because when your blood sugar levels are extremely high, what it does is it reduces your perception of pain, or the nerves which are supposed to get stimulated in an environment of pain do not get stimulated. So you're not even aware if you have chest pain. And by the time some people get aware of it, sometimes it's too late. Diabetes can severely affect your eyes and cause vision loss. It causes early onset cataract, retinopathy, vascular changes, glaucoma. It causes chronic kidney failure. So world over, when you look at the number of causes that can cause chronic kidney failure, the number one cause is diabetes. Then if you look at your feet, now feet is a huge problem for diabetics because they have a problem which is known as peripheral neuropathy. So the nerves that supply your feet and your legs sometimes because of elevated sugars can get damaged. So sometimes there's a complete loss or altered sensation from your feet, because of which you may not even be aware of the fact that you may have gotten wounded. You might have an injury, it's getting infected. the blood supply to your legs get affected, and all of these can cause a condition which is known as diabetic foot. So the problem with diabetes is not just your elevated blood sugar levels, it's these elevated blood sugar levels causing an effect and damage to various organs in your body. And that's the problem. So the focus today is to either identify the situation early, or even if you're diagnosed with diabetes, how do you reverse it? Now, when we come to an understanding of diabetes, we first need to understand insulin. Now, insulin is colloquially known as a sugar-lowering hormone. So this flower-shaped structure here is supposed to represent insulin. So insulin, when it comes, it attaches to a receptor on a cell here. Okay, and once it attaches to this receptor, a kind of a doorway opens up on the cell, and these molecules are glucose or sugar molecules, and they enter into the cell. And they enter into the cell and they get converted into energy. And this energy is utilized to carry out your day-to-day activities. So this is the function of insulin. Insulin is like a key to a door. Let's put it like that. It's a key to a door. If insulin is there, glucose can enter into the cell and get utilized for energy production. If insulin for some reason is not functioning properly, this glucose molecule cannot enter into the cell. So it floats around in the blood, and that's when you get elevated blood sugar levels. Now, there have been 4 lifestyle factors which have been identified as the reason behind the cause of development of type 2 diabetes. 4 factors: carbohydrate-rich diet, physically inactive lifestyles, sleeping less than 6 to 7 hours a day, or what we would call a sleep deprived state, increased stress levels. When these 4 factors come together, it causes the onset of a state in your body which is known as insulin resistance. As I mentioned before, insulin is a sugar lowering hormone. So in insulin resistance state, your cell suddenly becomes resistant to the action of insulin. Glucose cannot enter into the cell, and that's when the spillage of glucose into the bloodstream starts. From insulin resistance, you will move on to a state of pre-diabetes. From pre-diabetes, you will move on to a state of type 2 diabetes. So it's important to understand that diabetes does not occur overnight. There is a series of events which has taken place before the onset of diabetes. Now, if we go a bit more into detail about diet, so carbohydrate rich diet, how would you define it? Say 60 to 70% of your diet is essentially, if it is carbs in the form of rice or wheat or oats or millets, ragi, or refined carbohydrates like flour, all of these come under the category of carbohydrates. Now, when you have too much of carbohydrate intake, what's going to happen? A large portion of it is going to get stored in the form of fat over your abdomen, over your liver, and this fatty layer will start to resist the action of insulin. And once this resistance to insulin starts, it is almost like a signal from your body saying, I have more than enough stores of carbohydrate, I don't need any more. So it kind of tries to block the entry of carbohydrate into the cell. Let me put it, that's the simplest way in which I can explain it. And this will cause a spillage of glucose into your bloodstream, and then your blood glucose levels get elevated. Now, when we look at the correlation of, say, a physically inactive lifestyle and the development of diabetes, see, essentially, we are not meant to have a sedentary lifestyle. We're supposed to be physically active. But unfortunately, a lot of us today have a lifestyle where we're kind of stuck to one position or one chair almost 8 to 12 hours in a day. So what does this do to the body? First and foremost, there's a reduced glucose demand from the muscle. So a lot of the food that you're eating and a lot of the carbs that you're eating will go more and more into storage and less for energy generation. And obviously, this is going to worsen the situation of abdominal fat layer, increase in waist circumference, and this will also cause a worsening of the situation of insulin resistance. Because finally, it's this fat layer which is resisting the action of insulin. Now, when we look at the correlation of stress and the onset of diabetes, see, most of the stresses that we face today are more mental than they are physical. So your body has its own defense mechanisms to try and bring you out of that mental stress. So either it tries to activate a reward center in your brain, or it has another mechanism which is known as fight or flight response. So this activation of reward center in your brain is done through a signal that the brain sends to you to consume ultra processed, hyperpalatable, high calorie, carbohydrate rich food, which has zero nutritional value, zero fiber. Okay. And foods like this obviously cause more and more storage of fat in your body. Next, there is something known as a fight or and flight response in your body. So when we say fight or flight response, in the primitive days, of course, man had to face more of physical stresses which required him to either fight out the situation or run away from it. But today, most of our stresses are mental. We don't need this physical response, but because this axis has been present in us since primitive days, what it does is it causes an increased release of cortisol or steroid hormone into your bloodstream. And we all know prolonged release of steroids will cause a rise in blood sugar levels. When you're stressed out, what also happens to your body is you have a lack of motivation, a lack of drive. And obviously you don't have good quality of sleep, you don't wake up alert and active the next day, you don't feel like exercising. And all these factors, when they come together, they will cause excess fat deposition over your abdomen, over your liver, and this fat will go on to cause insulin resistance. Then there's a very close relation between insulin resistance and sleep. See, we're all supposed to be sleeping 6 to 7 hours in a day. Okay. And what happens when you sleep is your body undergoes a lot of repair, rejuvenation by the release of a hormone, which is known as growth hormone. When you don't sleep 6 to 7 hours in a day, what happens to your body? Well, the next day, of course, your body is 30% insulin less sensitive or more insulin resistant. Next, what happens is there are certain appetite hormones which are released. Now, there's an appetite hormone that makes you hungry, which is known as ghrelin. And there's an appetite hormone that's supposed to tell you to stop eating, which is known as leptin. When you're in this sleep deprived state, the hormone that makes you hungry goes up exponentially in your body. The hormone that's supposed to tell you to stop eating comes down. And as a consequence of this, you're always hungry. You're always going to have food cravings. You're always going to have sugar cravings. So obviously this is going to worsen the state of insulin resistance. Why? Because there's going to be calorie consumption. There's going to be carbohydrate consumption, sugary food consumption, all of which is getting stored in the form of fat or triglycerides. Along with this, of course, when you're sleep deprived, you do feel drowsy and physically inactive the next day. Another very interesting phenomenon which takes place when you're sleep deprived is, see, towards sunset, we all have a biological clock in our body, right? So towards sunset, there's a hormone that's released, which is known as melatonin. And towards sunrise, there's a hormone that's released, which is your steroid hormone. And of course, when you're in a sleep deprived state, this whole biological clock gets affected. So melatonin release does not take place. There's increased cortisol or steroid release, which is all going to worsen the situation of elevated blood glucose levels and increasing fat deposition in the body. Now, when we put these four factors together, excess carb intake is being stored in the form of fat or triglycerides over your abdomen or your liver. A physically inactive or sedentary lifestyle is causing a reduced glucose demand from the muscle. So more and more of the carbs is getting deposited as fat. And there's also insulin resistance being developed at the level of the muscle itself. Okay. Now, your sleep deprived state is causing an alteration in your appetite hormone. So this causes food cravings. And your stressed out state or your stressed out lifestyle will cause a continuous release of cortisol or steroid into your bloodstream. These factors come together, causes abdominal fat deposition, development of insulin resistance. Now, see, initially, your body tries to counter this situation of insulin resistance by releasing increased amounts of insulin. So, in fact, if you check your fasting insulin levels, you'll find they're quite high. And in fact, that's one of the first indicators of insulin resistance in our body. Now, insulin resistance does not just cause diabetes. Insulin resistance is the most basic biochemical abnormality which can cause obesity, elevated blood pressure levels, elevated cholesterol levels, polycystic ovarian disease, fatty liver, snoring problems, chronic inflammation in the body. So insulin resistance is something we have to understand and internalize within ourselves, because if we don't get this concept of insulin resistance, we will never be able to understand why how to reverse a state of diabetes and how to prevent the onset of other long-term health problems, other long-term lifestyle-related disorders. Okay. Now that we've spoken a bit about how diabetes even develops in the body, what are certain signs and symptoms your body can give you? So when we talk about signs of insulin resistance, so insulin resistance can be detected in your body either by a pigmentation around your neck or maybe skin tags around your neck, an increasing waist circumference, or a feeling of continuous hunger or food cravings are certain warning signs from your body of insulin resistance. Then when we take pre-diabetes, so pre-diabetes can manifest itself as extreme fatigue, tiredness, weakness, and lethargy, intense sugar cravings. It can also cause an unexplained weight gain, which you're finding very difficult to lose. It can cause hormonal imbalances, especially in women. It can cause polycystic ovarian disease. It can cause chronic pain, so increased frequency of headaches, increased frequency of muscle pains, joint pains. All of these could be a warning sign of pre-diabetes in your body. Now, when we come to diabetes, when your blood sugar levels are elevated so high and continuously, then you will start having symptoms of diabetes, which could be increased hunger, increased thirst, increased urination, tingling or numbness in your feet, increased frequency of urinary tract infections or fungal infections, wounds that take a very long time to heal. Some of these can be potential signs or symptoms of diabetes in your body. Now, if you obviously have the suspicion or have some of these symptoms, how do you go about and diagnose it? Very, very simple. So for pre-diabetes and diabetes, simple fasting blood sugar level or a postprandial sugar level, HbA1c will diagnose your condition. Now, if you want to diagnose insulin, just a state of insulin resistance, you can measure your fasting insulin levels or your fasting lipid or cholesterol levels or your inflammatory markers, which if elevated can indicate a state of insulin resistance in your body. Now we've understood the symptoms, we've understood how to diagnose it. Now let's understand how to reverse it. So now you've gotten diagnosed with, say, diabetes or pre-diabetes or insulin resistance. What's the way forward? Is it medicine? Is it insulin? No, it is lifestyle interventions. That's how you can go about and reverse your state of diabetes. So when we talk about lifestyle interventions, the same 4 factors which are causing the onset of diabetes, those factors need to be looked into again, and you have to bring about a habit change in your body. So the first most important point is your diet. What is the kind of food you should be eating to reverse a state of diabetes? So the first principle you need to apply is carbohydrate restriction. See, carbohydrate essentially plays only one role in your body, which is fuel generation. It has nothing more to do in your body. It's not considered to be an essential macronutrient. So carbohydrate restriction is basically 30% or less of 30% of carbohydrate in your diet, which could be in any form, in rice, in wheat, in oats, in millets, ragi, anything. And once you restrict your carbohydrate intake, you will automatically start seeing a reduction in your blood sugar levels. Next is protein. You need to have proteins in your diet. In fact, you need to have a high amount of protein in your diet. So a protein-rich diet is what is recommended. A lot of diabetics also have muscle loss. They have protein loss because of certain kidney issues. So slightly more protein-rich diet will help them. And proteins are also considered to be building blocks in your body. So proteins can be either taken in the form of plant or animal-based forms. So either in the form of, say, pulses or chana, rajma, or in the form of, say, fish, chicken, egg. All of these are sources of protein. Next, when we take fats. Now, fats also need to be included in a small element in your diet in the form of polyunsaturated fatty acids. Now, polyunsaturated fatty acids are found essentially in homemade ghee, in your cooking oils, in certain nuts and seeds. And these good fats are protective for your heart. They're important for certain hormone and enzyme signaling in your body. But there are certain fats which are known as trans fats. And these trans fats are what are harmful for your heart, and they are usually found in processed food. So that's something you definitely have to avoid. Also include fermented foods in your diet. Now see, fermented foods in the form of homemade curd or fermented idli dosa batters or pickles. Now all of these, what it helps in, it helps to keep your gut functioning properly, your immune system functioning properly. And also there's a gut-brain axis. So if you have the right kind of bacteria in your gut, you, in fact, your mood, you are usually at a very stable level. But if you have the wrong kind of bacteria in your gut, it can also cause anxiety, depression, or other mental health disorders. So it's very important that you include fermented foods in your diet. And of course, keep hydrated, drink at least 2 to 3 liters of water in a day. When we talk about fruits and vegetables, of course, you need to have seasonal fruits and vegetables, but avoid starchy vegetables like, say, potato, sweet potato, or yam. And also don't have too much of fruits when you're diabetic, because fruits have naturally occurring sugars in them which are known as fructose, which can definitely cause an elevation in your blood sugar level. So don't have high amounts of fruits. So carb restriction, protein rich diet, good fats, fermented foods, avoid starchy vegetables, avoid eating too many fruits, and hydrate yourself well. Now, along with carbohydrate restriction, you also have to practice something which is known as intermittent fasting. What I've shown here is meal plates of certain patients who practice this carbohydrate restriction. And if you see, the serving of the carbs, maybe in the form of rice or chapati, is very, very small. They have a slightly more protein-rich diet, because see, when you consume more proteins, there's no immediate or high release of glucose into your bloodstream. It's a more flattened kind of a curve. But if you have a carbohydrate-rich diet, the amount of glucose that is released into your bloodstream is extremely high. In fact, carbohydrates start getting digested in your mouth itself. That's the level at which it can break down and how fast it gets digested. Proteins take a lot longer to digest. Fats take a lot longer to digest. So there's a lot of rationale and thought process being put into this. Now, like I said, a combination of carbohydrate restriction and intermittent fasting has to be done. So when we do a combination of, So when we do a combination of carbohydrate restriction with intermittent fasting, what happens? So intermittent fasting is basically an extension of your overnight fast. So overnight, you usually fast for maybe about 8 to 10 hours, which is the gap between, say, your dinner and the first meal of the day, the next day, your breakfast. Now, this overnight fast, we extended to about 14 to 16 hours. And the first meal of the day would probably be a lunch or a brunch, say, at 11, and maybe an early dinner at about 7:30 in the evening. So the idea here is, we all know that carbohydrate is stored in the form of fat over your abdomen in your liver. How do you access that stored fats? The one way that you can do it is you can induce the slight state of starvation through intermittent fasting, which will cause the fats to break down into smaller molecules, and they then get utilized for energy production. So your body is no longer glucose centric for energy production, which means what? It is not dependent on carbohydrate for energy production. It will use the stored carbs, which is there in your body, the fats in your body, for energy production. So this is where I usually give an analogy to my audience. So imagine that you have a water tap, running water, there's a bucket filling up below, and suddenly if you don't switch off the tap, the water is going to spill out. So the running water from the tap is your carbohydrate intake. The water that's spilling out of your bucket is the elevated blood glucose levels that you have. So now how do you stop the spillage of water? First, switch off the tap, which is reduce your carbohydrate intake. Now the bucket is still full. So even if you take more carbs, it's still going to spill. So how do you utilize the water that is there in the bucket? Intermittent fasting. So intermittent fasting will induce that slight state of starvation, wherein you will start utilizing that stored fat or that water, as in the analogy, for energy production. Now, another thing that you have to implement at this time to utilize stored food or the stored water is exercise. So we all need to do some form of aerobic exercise every day. So 30 to 45 minutes moderate intensity aerobic exercises, either in the way of walking or running or jogging, swimming, cycling, sports, your household chores, grocery shopping, are all various methods in which you can do aerobic exercises. Along with aerobic exercises, you also have to exercise your upper as well as your lower body. So see, when you walk or when you cycle, you're essentially exercising your legs. But what about the muscles in your hands and your back and your chest? How do you exercise them? So a simple way to do it is either you do swimming or play a sport like badminton or tennis or cricket, or you can do some form of resistance training, or you can do yoga, all of which will exercise your upper body. So the more muscles you exercise, the higher the intensity of exercise, the muscles will take up more and more glucose from the blood for energy production. And then that is when your blood glucose levels start coming under control. The reversal process actually sets in. So it's very important that you have your aerobic exercise, you have your upper body exercises, an element of yoga and meditation is very, very good to include, and a bit of resistance training. Now, along with, of course, your diet and exercise plays some of the most important roles in this reversal process of diabetes. But then your sleep and your stress reduction is also very important. So we all know that we're supposed to be sleeping at least 6 to 7 hours in a day, right? So follow a sleep routine where you finish your meals 1 hour before going to bed. There's no screen time, at least half an hour before going to bed. No nicotine or caffeine or alcohol before going to bed. Or along with that, you can also maybe listen to some calm music, do some meditation, like a whole wind down before you actually get to bed. And all of this will ensure you fall asleep quickly and your quality of sleep is also good. So it's important to have a sleep routine. Now, along with this, it's important to keep your stress levels under control. Now, see, stress is one of the most important factors, especially in our generation, because it is the cause for diabetes onset in young. Stress, I would say, is one of the most important causes. So how do you reduce your stress levels? I know everyone says meditation, calm, peaceful music is the way to do it. Of course, that's step one. But if that doesn't help, you can always reach out to a friend, a family member, or you can seek professional help. Or you can also break your problem down into smaller, simpler problems and have a priority to-do list as to which problem you will address first. So you have a more solution-oriented approach to it. You can journal your thoughts down. All of this help you feel a little less overwhelmed and pressured by the stressful situation that you're facing. Along with this, of course, you all have to strike a work-life balance. I know this is something that everybody talks about, but it's very, very important and it's very easy to do. So take time out to have meals with your family. Maybe plan a weekend getaway once in a while. Play with your kids, play with your dog, all of which what it's going to do, it's going to release those feel-good hormones at that time. So you're not going to have that elevated cortisol level. You're not going to have those elevated hormones in your body, and you feel a little less stressed, a little less anxious. Your heart rate comes down, your respiratory rate comes down. And in fact, that's why meditation is recommended to so many people, because meditation has the power to relax your mind. Meditation has the power to reduce anxiety in your body, reduce steroid levels in your body. So it's important that you practice at least 10 to 15 minutes of meditation, strike a good work-life balance. This is the way that you would go about reversing diabetes. Step 1, carbohydrate restriction. Step 2, intermittent fasting. Step 3, aerobic exercise. Then step 4, sleep, 6 to 7 hours of sleep. Step 5, stress reduction. That's the way to go about reversing your state of diabetes. And the most important factor in all of these 5 steps is your carbohydrate restriction with intermittent fasting. Now, see, when you do a combination of these two, you cannot do it alone. You should always do it under the guidance of a dietitian or a nutritionist who will tell you the right way to go about it. So if I make like a journey, say you felt that you have certain symptoms that might suggest you're diabetic, you can do a health assessment, check your fasting blood sugar, HbA1c, cholesterol levels, say your kidney, liver function, and vitamins. And if you find your blood glucose levels and HbA1c levels are elevated, what do you do next? Of course, you will talk to either a physician or a diabetologist or endocrinologist, talk to a dietitian and nutritionist who will implement lifestyle interventions. Of course, if your blood glucose levels are highly elevated, say in the range of 250 plus 300 or 400, you will have to get on to some form of medication or insulin, but that might be temporary, because if you actually strictly follow the methods that I have mentioned here, you can definitely reverse your state of diabetes. So a few words about the Diabetic Care Program we do run at Mfine, which is based on all the principles that I've just spoken about: the carb restriction, intermittent fasting, exercise, sleep quality, and stress reduction. So you would almost address this as the 4 pillars of health. It's like a holistic approach towards reversal of diabetes. And this is done by a team of diabetologists, dietitians, and health coaches. So the diabetologist, of course, will keep a continuous watch on your blood sugars and how you're responding to the diet or medication. The dietitian has a very, very important role to play because she is the one who would give you the dietary guidelines that you need to follow to bring about the reversal of diabetes. And the health coach is constantly there to do hand-holding, to do motivation, to help you achieve your goals, to remind you to sleep on time, to remind you to keep your stress levels under control. And if you're feeling overwhelmed by any of these situations, that person would be your point of contact, who will then either get somebody senior in to help you deal with that situation. Now, how do we do it, of course, is something that I've already spoken about. And whatever I've spoken about, these are recommendations given by diabetes associations all over the world who've done a number of trials and studies to prove that lifestyle intervention is the way to go, because that is what will bring about a reversal in a state of diabetes. We have, like I said, we have a team of diabetologists, dietitians, and health coaches. The program is structured as a 3-month program. So you get 5 consults with the diabetologist, a weekly consult with the dietitian, a weekly wellness session with a sports medicine specialist who will teach you what exercises you need to do to bring about that reversal of diabetes. And I do think the USP of the program is the dietitian, of course, asks you to share a lot of meal images wherein we understand a bit better about your cuisine. We understand if you're following the correct portion sizes for a reversal of state of diabetes. So we're constantly there at every step, helping you, correcting you, helping you understand much better. There are also lab tests available at the start and end of the program. And I think all of us at Mfine are all focused towards a more healthier India, improved quality of life. The whole focus is on identifying what is your root cause of diabetes and helping you reverse that, because that will bring about a reversal or in diabetes, or a better control of diabetes. And but of course your medications reduce, there's an improvement in the overall parameters in your body, and any correlated comorbidities that you might have because of diabetes also start coming under control. So this is what we are entirely focused on. Reversal of diabetes is possible. It's a fact. It's here to stay. It's doable. This brings me to the end of the talk today. Open to take any questions. You can either post in the chat box, or you can unmute yourself and ask me the questions. Okay, there are only some questions. Preet, can carbs be completely removed from a diet for a non-diabetic person? See, if you're non-diabetic, remember one thing: never remove anything from your diet. Every element of your diet is important. The carb has a role to play, the protein and the fats have a role to play. Don't remove. Restrict your carbs. That is what I would say. Do not remove, restrict. That's very important to understand. Nishita, we talked about carbohydrate restriction, need to understand sugar restriction. We do not talk about reducing maida in diet or sugar in diet. See, Nishita, when we talk about carbohydrates, maida is a form of carbohydrate, sugar is a form of carbohydrate. So these two are known as refined carbs or processed carbs. So carbohydrate is like a blanket rule. So like I said before, rice, wheat, oats, millets, ragi, white or brown sugar, your maida, all are various, even your bread, all are forms of carbohydrate. All of them, all these grains are forms of carbohydrate. And that's why the whole focus is on carb restriction. And that's why it's important to talk to a dietitian nutritionist, because she will identify these hidden sources of carbohydrates that you have and help you eliminate those. How much lifestyle change reliable against medication? So Ketan, lifestyle change is 100% reliable, and I'll tell you why. Because finally it involves what kind of food you're eating, how are you exercising, your sleep and your stress. This is the reasons why you develop diabetes in the first place. But like I also said at the start, there are some people who have very high blood sugar levels who have to be on medication or insulin, at least for some time, till their sugars come under control. See, you cannot just stop off your medicine and do only lifestyle changes. You have to do a combination. As your blood glucose levels come under control, the doctor will start slowly reducing your medication. It has to be a gradual tapering. Otherwise, what would happen is your blood glucose level will go shooting up. Okay. Should carbohydrate be removed in that case? Nishita. See, like I said, don't remove anything from your diet. Okay. It's just about portion control. Nerve pain treatment. So Shima, nerve pain, if it's related to diabetes, first and foremost, we need to understand, is the nerve pain because of elevated blood sugar levels or because of nerve damage, which is neuropathy? If it is because of elevated blood sugar levels, you have to get your sugars under control. No matter what drug you take, it will not work. If it is because of neuropathy, of course, you do need to go to a neurologist or diabetologist or someone who will put you onto certain medications, which are known as neuropathic medications. Okay, so you can't take it over the counter like a normal painkiller that you would take. So you need to go to a neurologist. They will do a nerve conduction test. They will identify which nerve is damaged, and then they will decide what treatment works for you. Please suggest some good sources of plant-based protein. So Aniruddha. So Aniruddha, good sources of plant-based protein is chana, rajma, your tur dal, urad dal, masoor dal. All of these are good sources of protein. Chana is a very, very good source of protein. This doesn't mean you eat chana masala every day, because then that's very high in your calorie intake. So you can have boiled chana in the form of a salad, where the calorie count will come down. My mother had a
I think
sugar test.
doctor, we left one. I think one came from Ketan. How much life cycle change reliable against
So that is
inflammation?
the one I was talking about, that lifestyle change has to be done with medication. And then once the blood glucose levels come under control, you will gradually be taken off the medication. You can't do like a complete cutoff because that's too risky. Even for senior people. Okay, now I understood what the next question was. Even for senior people, it's the same thing. Medication with lifestyle change. As the sugars come under control, we taper off the medication and stop it. My mother had a sugar test recently. In the reports, the fasting sugar levels was about 105. Is this to be considered a pre-diabetic state? So fasting levels of around 105 is considered pre-diabetic. We call it impaired fasting blood glucose levels, but you need to do maybe another test, do an HbA1c test. Now, the HbA1c level is above 5.5, above 5.6, then we would really consider it as pre-diabetes. Just a one-off fasting blood sugar level, say of around 105, we can't label it, especially without an HbA1c level. What is the role of paneer ke phool in controlling sugar and helping insulin release? What is paneer ke phool, Ajay? I'm sorry, I don't know what that is.
It is paneer dodi, which soaked in water overnight, and after filtering it, means taking the stock of that. I read also that it controls sugar level. I thought you would be in a position to tell me, and it does activate the pancreas to release
Insulin. Okay.
I have been doing it last 20 days. Another 10 days I will do and check my sugar level. That's
sugar level. It will be very interesting. Do tell me if you're seeing a control. But to be very, very honest, sir, I'm not someone who knows much about this. Though I know something like in Ayurvedic days and in older days in India, there used to be something, our own Indian version of what do you call gruel or something, which is this fermented rice water kind of a thing that they used to do, which they also claim brings your blood sugar levels under control. But there's no evidence that I have to say it works. But sorry, I really don't have an answer for this.
Fortunately, after 7 days of doing that and stopping insulin intake, means the injections which I were prescribed, I've been taking for a longer period. When I checked my sugar level, it was just 50 units more than when I took my injections. So I'm going to see another 10 days. That is going to complete 30 days of this. And let's see, like, if I can be, if it turns out to be that it has helped me, I feel it has to a certain extent.
to some end. See, it's good. Like, see, this is what I like, because we also want to learn things, right? You know, we cannot be with blinders. That's why I'm very interested to now know about this. That, okay, what is this and how much control you're achieving? So we should definitely keep in touch so that I know if you've got a better control of your blood sugar levels.
Sure.
Yeah. So wait, let me, next. What to eat for breakfast and dinner when even wheat contains carb? Is milk safe for diabetics? My mother-in-law consumes wheat 3 times in the form of chapati with veggies. Is it safer? So Shima, don't consider it like a poison. Okay, so you just need to restrict it. So for example, if your mother-in-law consumes wheat, say for breakfast, lunch and dinner, see, that must be her habit. So you just reduce the quantity. So instead of 3, have 2. Instead of 2, have put 1. Increase the quantity of the vegetable curry, preferably a dry vegetable curry, not gravy, because we're also looking at calories here. Include a dal, maybe for lunch, put a bowl of dal. It can be plain dal, dal fry, it can have something added on to it. Anything like that, that's fine. So don't start thinking now carb is a poison. It's not poisonous. It's just that we're having way too much of it in so many sources that it's becoming a problem. So the best way to do it is, she's in a habit of having chapati for each meal. First, reduce the quantity. So that's your carb restriction. And then what you can slowly do, maybe one meal, say for breakfast, you can make it protein based. So you can have, say, a moong dal dosa, or you can have a chana salad, or you can have sprouts, or if she's comfortable eating eggs, you can have boiled eggs. Slow. It's not like, you know, it's not that it will suddenly become poisonous to her. You just have to reduce the quantity, and I think that is fine. Next, coming to milk. So cow's milk sometimes does cause an elevation in your blood sugar levels. And to be really honest, as long as your kids, you have enzymes to digest milk, after that you don't have. So you don't need to consume large quantities of milk. You can have it in the form of curd, have it in the form of paneer, which is absolutely fine. It's safe. But if you consume large quantities of milk, especially cow's milk, it can cause an elevation in blood sugar level. So you can cut that. A small cup is okay, and little bit more in the form of, say, buttermilk or curd or paneer. Can we get more details about the diabetic reversal program enrollment and other things? So Nishita, I will talk to you about this a little later. To get into more details of that, what are some of the common foods for diabetics? So Aparna, see, as far as diabetics are concerned, I did say we need to restrict your fruit intake. So there are some fruits like, say, banana, mango, watermelon, sapota, which are very high in sugars or fructose. So cut that down. Have more fruits like guava, papaya, jamun, citrus fruits, any fruit that doesn't taste too sweet. Let's make it very, very simple. The sweeter the fruit is, the higher the fructose level. That's the most easy way to remember it. So the more bland the fruit tastes, the more safer it is for a diabetic. And diabetics should not have a fruit bowl every day. So restrict it to 1 or half a fruit a day, and preferably in the form of fruit and not fruit juice. Is lactose free? Oh, sorry. Is apple safe? Yes, Shima, apple is fine. Apple is okay. Ajay, is lactose free milk safe? You can have it, but see, they'll all have some amount of carb, okay, in various forms, okay. So carbohydrate is a big complex molecule. Within that big complex molecule, we have smaller molecules, okay? And the way each smaller molecule is arranged is the way we have various forms of food. So no matter how you take your milk, there will be some element of some kind of carb hidden inside it. So you can have it. Again, like I said, don't consider any form of food poisonous. Anything that naturally occurs in the world or environment is not poisonous to you unless you're allergic to it. You have a food allergy or something like that. You can take it, just watch the portion, right? Don't have too much of it. Preet, I'm 22 years old. My father's diabetic and a heart patient. Should I get any test done or a complete body checkup? So see, Preet, this is something I tell everyone. All of us get health checkups done at least once a year or once in 2 years, which should be fine. You're not diabetic, you have a family history, an annual health checkup is fine. And always ensure that that annual health checkup has your HbA1c and fasting blood sugar levels. Of course, cholesterol also, because elevated triglycerides is also an early indicator for insulin resistance. You can include things like CRP, ESR. If those are elevated, again, that tells us. So these are clues that we get. So what are the clues in, say, your health checkup? Why don't I tell you that? When we find elevated triglyceride, with increased CRP or ESR levels, borderline elevated fasting blood sugar levels. All of these are indicators for us that there's a risk of early onset diabetes. So once a year is good enough for you. And of course, eat right, carb restriction, exercise regularly, have home cooked food, don't have too much of outside food. My mother-in-law has frequent headaches and dizziness. So Shima, there can be two reasons for headache or dizziness. Low sugar itself can cause it. Very, very high sugar, some people experience it. Very high blood pressure levels, they experience it, and low blood pressure also. So both ends of the spectrum have very similar symptoms. When she's experiencing it, check the sugars on the glucometer, check the blood pressure on a digital BP apparatus, and that will tell you why those episodes of headache and giddiness is happening. What should be the time gap between two consecutive meals, one in the morning, one in the evening, nothing in between works? Yes, Ketan, that's fine. If you have your first meal, say around 10 or 11 in the morning, you have an early dinner of about 7:30 in the evening is okay. But for a lot of people who are non-diabetics, now this is something we advise diabetic patients for reversal. It's called a 2-meal plan. Okay. Now, Ketan, I'm assuming you may not be diabetic. So otherwise, healthy individual, breakfast is considered to be one of the most healthiest meals of the day. So another way in which you can do it is have a breakfast, maybe have a protein meal somewhere in between for lunch or a snack, and then take a dinner. So that's another way that I would suggest you. Do talk to a dietitian once, and then she can help you figure this one out. And for young people, exercise more than cutting down your food intake. I think the higher intensity exercise you do, the better it is. What are your thoughts on the impact of a vegetarian versus non-vegetarian diet on your body? Are there any long-term negative impacts of meat on your body? There's a lot of debate going on about these two diets. What are your thoughts? So, Aniruddha, are you asking my personal opinion, or you're asking me what trials and studies are saying? To be very honest, I'll answer this in two ways. See, of course, vegetarian diet is good. There are a lot of studies which are saying if you have a non-vegetarian diet, it can cause inflammation in your body, it can cause health problems. It has not been proven yet. We have not got any studies or trials which completely prove the fact that non-vegetarian diet is harmful for your body. Okay. What we do recommend is have things like egg, fish, and chicken. Avoid red meat for sure. These are the three options that you can follow as far as non-vegetarian food is concerned. Even from a point of science, we don't recommend consuming red. We only recommend consuming egg, fish, and chicken. Fish is very good in omega-3 fatty acids, which is very protective for your heart. Egg is also a very good source of natural fats and proteins. Chicken, again, a good source of protein. So these you can include in your diet. From a scientific perspective, there's no harm. In fact, it's considered to be good for your diabetes control. Is boiled egg yolk safe for diabetics or only boiled white? So Shima, boiled egg yolk is also completely fine. That's not a problem. These are naturally occurring fats. It won't do anything to you. It's the trans fats which cause a problem, which are there in processed food. This almost felt like a rapid fire round. But any more questions?
Yeah, we would be happy to take them. I think we got one more.
Been skipping breakfast since I shifted away from home. I'm assuming maybe proteins may be lacking for my body, will get it checked. Any multivitamin or protein pills that can be intake? No, please don't take anything in the form of a pill when you can take it in the form of food. Just eat normal home cooked food. Your vegetables are a good source of vitamins and minerals for you. Paneer is a good form of protein for you. Chana is a good form of protein for you. Boiled egg is. So if you're skipping breakfast, you're okay with it, that's fine. But when whatever meal that you're eating, balance it out. Have some protein, which is your dal. Your carb can be your chapati, 1 or 2 chapatis, or just 100 grams of, say, brown rice. So whenever you go for rice, go for unpolished brown rice. And when you're going for diabetes reversal, we usually recommend a restriction of anywhere between 50 to 100 grams of rice, but that's dependent on your sugar levels. It's not a blanket rule. And have your seasonal fruits and vegetables to be fine. Please don't pop any pills. Unless you have a deficiency, do not take medication. As much as possible, eat healthy. The food that naturally occurs in nature is very, very good for health. We are just not eating it right. Does diabetic medication for a long period cause any kidney damage? So, Ketan, there are certain medications, let's not say certain medication. See, all medication in diabetes per se itself causes kidney damage. Okay, most diabetic medications are safe. There are some diabetes medications that cause some amount of side effects. Like, say, for example, there's a molecule which is known as metformin that causes B12 deficiency and gastric problem. There's a new molecule which is known as SGLT2 inhibitors, which is kind of flushes out sugars through your kidneys. None of these medications have been shown to cause kidney damage. The diabetes itself, when long-standing and not controlled, can cause kidney damage. So don't worry about medication. And also, if you're already on medication and you're taking high doses, this simple diet change, exercise, stress control, or better sleep, all of this is going to help you reverse that state of diabetes and even reduce your medication. So maybe focus on that, and that will help.
Doctor, one more thing I wanted to ask. You said, like, hey, take more protein, take less carbs. But so I did a health checkup recently, right? So I was following, hey, less number of carbs, high protein intake. And what I got to know after the annual checkup, that my uric acid has shot up.
Is elevated.
Yeah.
Uric acid is actually an inflammatory marker in the body, just like CRP and ESR. So the way around it, now what do we do? Now your uric acid is elevated. How do we counter it? More plant-based protein, less animal-based protein. So the one that really triggers your uric acid, and the problem with uric acid is gout. So it can cause gout, which is very, very painful joint problem. So red meat and alcohol are the two things which can really trigger it. If you can keep off these two, rest of it is fine. So you can have plant-based protein, have more of chana, rajma, all the other forms. They're not too high in protein. That should be fine. That should take care of it. And exercise. Yeah. Exercise is also very, very important. So that's the way to bring it under control. If it is, say, extremely high, then your doctor might put you on some medication, which is fine to use, just because the risk of gout comes down.
I think my doctor suggested me, hey, not to take protein. Go on a balanced diet now.
So rather than that, why don't you talk to a dietitian? So they'll include some proteins which are safe for you. They'll ensure that your carb and fat is also under control. See, like this is the human body is not same for everyone. If our fingerprint is not same, how is our human body same? So what I've suggested is a suggestion. Finally, we need to go to the specialist who's our dietitian or nutritionist, who will see your body, who will see all your health problems. And very important, they'll see your cuisine. If I give a North Indian ki subah mein aap baith ke 2 idli khao, they will not be happy. If I give a South Indian that you sit and eat poha, they will not eat. So you have to, in India especially, our country is so culturally diverse that if you don't take these factors into account, you can never bring about reversal of diabetes in them. So that's what's important. Do go talk to your doctor, talk to your dietitian. There are simple ways around this. You just have to do various permutation combinations and it will set right.
I think we got two more. We got two more stuff. I think
any discount for us at I think, Sanjit, you need to counter these questions.
Yeah. I think if you folks are interested, you can drop me an email and I'll put you. I'm dropping my email.
I have, I think, a form here in which they can just, if you're interested, you can just fill in your details there and I'll have somebody from Mfine who will reach out to you. How about we do that? Okay.
Yeah. Or if you folks, you can reach out to me. I'll put you in touch with the team.
Done. Let's just put it here. So anyone's interested, you can just fill up in that Google form and Mfine team will get in touch with you and they'll explain about the program, or you can drop a mail to Sanjeev who will take care of it for you. Last question, Shima, my mother-in-law has scalp pimples. Is it because of high sugar levels? Yes. So when you have diabetes and high sugar levels, it can cause all kinds of infections, especially skin related problems are quite common. Shima, I think meet your doctor again. I think you need to have a relook at her medication, relook at her diet to get things under control, and then all of these problems will settle down. I think her sugars are quite high, because I've been seeing the trend of the questions, and I've understood that, okay, the sugars are quite high and they need to be brought under control. So you can look at her diet, look at her medication. She'll need a combination of both. And this is also something I want to tell everyone here. If you're a very, very long-standing diabetic, if you've taken medication for many, many years, say 20 years, 25 years, your age is 70 plus or something, then obviously we're looking towards reduction. Okay, let's be realistic here. Elderly people, sometimes it takes time. It takes time to get things under control. You maybe require more than 3 months. It might take 6 months also. And also for people who are around 70 and 80 years of age, we don't look for very tight sugar and blood pressure control. We kind of let it be a little bit, because if you get it too much under control, low sugar becomes a higher problem for them. So have a talk with your doctor and your nutritionist, and they can correct this situation for you. It's not that tough. It can come under control. Thank you, Mr. Ajay. You've been one of the best participants I've ever had. You've asked such good questions, and you gave me something very nice to think about, which I want to talk with my dietitian today. That please, let's look into this, and if it's something good and helpful, we would love to implement it. Thank you all so much.
Yeah, folks, do fill the feedback form so we can call Dr. Abhishtita again on Plum maybe next month, and we can have a detailed talk about diabetes and
Madam, it was really interactive session. One of the best sessions that I had.
Thank you, sir. Thank you so much. It means so much to me, because I do want to raise awareness. See, I'm a diabetologist myself. I know I prescribe medication. I have to prescribe insulin in many situations. But there's a fact, and I've seen this. People have reversed their diabetes. They have a healthier lifestyle. And when you see it with your own eyes, you believe that, yes, this is possible. And I think I'm so happy all of you. I feel that you're motivated, and I want you guys to just start today. Eat right, exercise, sleep, get your stress levels under control. So thank you all so much. Thank you.
Ma'am, it was a wonderful session. My mother-in-law is also sitting beside me, and she's listening each and every bit. She can't communicate in English. That is the issue. But whatever she's saying, I have just written in the chat box.
Thank you
so you have cleared all her doubts. She's saying thank you to you.
Thank you. What language does she speak in?
Hindi.
Okay, namaste. Thank you. आज आप आए, और definitely आपका शुगर कंट्रोल में आएगा. आप घबराइए मत. अगर आप घबराएंगे तो और भी बढ़ेगा. पहले तो आप रिलैक्स कर लीजिए, थोड़ा खाने पे ध्यान दीजिए, थोड़ा आप अपना मेडिकेशन अपने डॉक्टर के साथ बात कर लीजिए, और सब कंट्रोल में आ जाएगा. Don't
worry. She wants to consult you. So what is the process she's asking?
वो जो फॉर्म मैंने डाला है, उसमें डिटेल्स डाल दीजिए. You can find me there, and anytime I'm here to help. And I see, and for your mother-in-law, she's almost like a mother to me. हम चाहते हैं अपने पेरेंट्स का हेल्थ अच्छा रहे, हमारा फोकस भी है, तो as much as possible हम definitely help करेंगे. Okay, thank you all. Thank you.